I run a company in San Francisco called Engage Buy Sell. We've been in business about 15 years. We are a cloud-based technology company. I'm going to spend a little bit of time, maybe 5-6 minutes, talking about the different kinds of technologies that can accomplish this. How do you engage with employees that are never sitting at their desk? And then our star speaker, Dr. Lawson, will talk about how he's employed in his line of work, which is very interesting, an ICU unit in Augusta, Georgia. These kinds of technologies that you might not think this disparate staff would be using. So we work with everything from healthcare organizations to colleges to museums, so quite a few different types of organizations. We probably have 1 million interactions a month that come through. So we have a good basis now. We've been doing this for so many years. We have a very good basis to know what's working and what doesn't work because we track all of that. And we'll talk about that in just a second. And Dr. Lawson, you want to tell a little bit about your background?
Sure. So I'm Andrew Lawson. I do trauma surgery, emergency general surgery, and surgical critical care at Augusta University, which is just a couple hours down the road. We are very busy. We have the only regional trauma center in the area. We have about 3,000 activations a year. So as you can imagine, that keeps us busy. We're the state hospital as well with the state medical school. We get the referrals from all over the state of Georgia to us. So we're very busy. Nobody sits at their desk. And so when we found the technology that God by Cell that they allowed us to use, it was super beneficial. And we're here to essentially show you what we did.
We had lunch together, and I decided I never want to be an ICU trauma head guy. Whatever stress we are facing is like 5 minutes of stress that he has during a day. All right, so that's Augusta. How many of you have heard of Augusta? Okay, that's great. So some of the challenges today, when we poll our clients, they say these are the 4 biggest communication challenges that they're facing. Like Dr. Lawson said, their teams are nurses and doctors and residents. They're never sitting really at a desk. And I guess probably 50% of the workforce these days are out and about. So communicating with them using kind of old-fashioned tools isn't as easy as it has been in the past. Struggle with retention, that's retention of material. Everybody talks about drip learning these days and just-in-time learning. If you ever go to ATD and some of these big training conferences, that's all you're going to hear about. The top right, limited access to email, I think, for most people these days. If just because you have access to email, somebody told me it's just another app on their phone. I check it when I want to check it. Just drives me crazy. I check email all the time. How many of you are really on your email game? Okay, this is why you come to these conferences. It's all of your peers that don't come to these conferences that are not reading your emails. And then how do you communicate? If people are not reading your email, how are you going to communicate with your team? So these are the big challenges that we keep seeing. What are some of the solutions? Well, I predict in the next 3 years, almost everybody in the room will have your own little texting platform. If you go back to, what was your name? Bryn. Would you give up your texting platform? Never. And that's what we hear is, if one takeaway for today is go find a texting company, start it. It's not that expensive. Once you start on the texting road, if you make it permission-based, which is the key so that you don't spam people, you will be amazed. You will never, ever go away from texting. It's not going to replace maybe what you're doing, but it's a game changer. So we, every year, poll I guess we've got 4,000 clients. We poll our clients and we say, okay, we're looking to build new technologies. What are the key things that you want us to build in terms of new technologies? And every year the list changes a little bit, but these are the 9 criteria that we're given. So different from Dr. Lawson, who is the end user, we're the technology company that puts everything together. It's got to be really easy for people to use. You know, a lot of technology takes a manual that's a little hard to use. Texting is one that is not hard to use. It's got to be cheap. You can't go to your boss and say, I want to spend $20,000 on some new solution. They're just not going to do it. You know, you've got LMS and HRS, you got all these other systems. It has to be responsive, so you can do it on your phone or you can do it on a computer. Cloud-based, obviously, so that you can have full reporting. It's got to have engagement. When we started down the path of just doing text messaging, we found out that it got a little kind of thin after a while. If all we did was just send text messages, the opt-out rate after a year started to increase. So we started using, and we'll show you this in a second, little mobile sites to land people on a page where there's some content, something more than just a text. It's got to be quick to install. You folks are very busy. You don't want to spend a day trying to install something. Has to be really easy for techies. How many non-techies do we have in the room? We have Paul, the guy in charge of all of AV is a non-techie, okay. And everybody can access. How many folks do you are here that have employees that don't have company email accounts? Probably, maybe half. So that's a problem if you want to get some kind of a benefit information out, or even a weather alert, or any kind of communication. So we started exploring downloadable apps. We were really big in downloadable apps maybe 5 or 6 years ago, and now it's pretty rare that we have clients that come to us. And the reason is they have found that the employees don't always want to download the app. They're a little worried about Big Brother, some kind of looking at what's on my phone, even though that's not possible. And so downloaded apps have fallen to the wayside a little bit in the clients that we serve. So then we were looking at messaging, like WhatsApp and WeChat, but those are not quite ready yet for the business environment. I think that's coming. Social media, how many of you use social media to get kind of internal communication out? Anybody use LinkedIn, Facebook? Yeah. A lot of small charities and museums are using that, but for the most part, it's not ready for prime time for most of you folks. And then, of course, texting and mobile websites. So putting this all together, what we've found is that the combination of using text messaging, where people can text in and opt into various lists, and you can have 1,000 different lists, and then you can push out messages, just like Bryn was saying. And then if you want, you can include links to your intranet, to a poll or a survey, to an agenda, to any kind of content. And those are the services that we've gravitated towards, and we provide our clients, is a texting service and then this mobile platform. So that's after probably 10 million interactions over the last 12 months, that's kind of the conclusion that we have come to. Examples might be benefit portals, onboarding portals, and recruiting, just like Bryn was saying, and polls and surveys, keeping information in like a 3-ring binder, but it's all digital on one portal. All of those are just examples of how our clients are using this. So now I'll turn it over to Dr. Lawson. He has a mobile site that uses our technology, and Dr. Lawson will kind of walk you through that. But that's an example of something that he and his team built and changes content on the fly. All right, so Dr. Lawson.
All right. So now you guys can see what we're working with. So I'll tell you a little bit more background so you can sort of understand what we have done. So like I said, we do emergency general surgery and trauma and surgical critical care. All that's recently in the last 5 years been sort of coined under the new umbrella of acute care surgery, which just basically means people that come in with a surgical need that is acute and or needs to be fixed immediately. As you might imagine, a lot of those people are extremely sick as well. So we run a daily census in the ICU that's really high, 15 to 20 patients on a regular basis. Because of all those things we have in all the different directions, we have learners everywhere. Each of those individual areas has a resident team, which means people that are through with their medical school have decided to be surgeons and are in training. Each of those different areas has a fellow. Each of those different areas has medical students. They have nurses in each of those areas. And so it's really important for us to be able to communicate with all those people at the same time sometimes. In addition, there's a lot of information that we need to be able to get out. There's guidelines. So when a trauma patient comes in, I want them to be treated in a specific way. And I don't want to reinvent the wheel every single time a trauma patient comes in, because sometimes it's life-threatening. And so we need to make sure that the residents have that information at their fingertips to where they can pull up the app essentially, and they're like, okay, we have this specific injury pattern, this is what he wants me to do. And the medical students have access to this as well. So really, what's created is an app, a mobile-based app, that we can combine the function of texting and all of that information that we had on 20 different areas around the hospital intranet that the residents or the medical students or even my partners didn't know how to access in one location. The app has the ability to set specific lists. So if I want to tell my admin, she can send out a text message to every resident that's on service for the EGS team, for instance, that there's a lunch for this specific person. Or if we want to say all the residents need to report to the conference room for their daily education because nobody showed up and it's noon, then we can do that too. So it has the ability to cross a lot of different lines and give information in a lot of different ways. There's phone numbers all over the hospital. So if you guys hit on hospital hacks, then you can see I've listed all of the phone numbers for the entire hospital. All they have to do is punch a button, and then they can call directly to the operating room where one of us usually is operating, or they can call the ICU where one of us is normally there, or to check out a patient maybe to one of the nurses there. So there's lots of different utility. They have their calculators. So when they're on rounds, they have one-stop shop. And the idea was we sort of put a lot of things in there that they're using on a daily basis to sort of incentivize them to be using the app regularly. So the calculators, they're already going to use those things. Now they don't have to think about where to go find them. The phone numbers, they're already going to use those things, but now they don't have to go to the nurse's desk and flip through a book. Instead, they get in the habit of every time they need something, they go directly to the app. And then all that information is already there, so that it's sort of pre-programmed in their brain. When they need to know how to treat a patient, they already know to go to the app. We also do feedback on this. So if we interview a specific candidate, we have the ability to go in and actually everybody can put their interview or evaluations in directly. We do feedback in the form of resident operative autonomy notes. So if we operate with a resident, and depending on their performance through the case, they actually get graded on that every single time. We have the ability to go in and say, hey, you did this right, you did this wrong, and in real time provide feedback that then gets delivered to them immediately via their app. So you can see this is the main page. This is our hospital hacks. All you have to do is click one of those numbers and you're talking to somebody at the OR charge nurse or the OR front desk. You can do all sorts of, we have links to a lot of their classroom material. So we teach advanced trauma life support at our system for those residents and some of the trainees in other programs. The emergency room, for instance, their trainees have to come through our service line to do that. And all of that is given in the app itself under ATLS, so they can download the book right there. So the benefit is they don't have to be sitting at a computer for me to get in touch with them, because frequently they're not. Frequently they're all over the hospital in various different settings. And now I can reach them at any time. I have the ability to push things out, set calendar invites, in addition to give them incentives to download it all in one easy. Even we included the cafeteria menu as well. So again, we incentivized it as much as we could. Sure can. That's a good question. So in order for them to opt in, I made a QR code, or it was provided essentially by the company, the QR code. We set the QR code at my admin desk, and then they just come by and scan it. It hasn't been an issue, though. They've loved it. So every one of them has come by and gotten the app, because it's so much of a thing that is so usable for them in a way that they didn't have before. A lot of these guidelines were all over the place in different segments of the hospital intranet. The hospital menu, nobody knew that it was even linked to the hospital menu before there was actually a website that you could get there. Usually you just have to go down to be disappointed. the calculators were in a different, on the internet, but a completely different section. So all of that stuff is, and then the phone numbers were in a little binder in all of the nurses' station. But I mean, it's like a 5-minute task to track the nurses, the clerk down, and look all that stuff up. So. In this case, I think it sort of works to our advantage. So this is the information we want them to have, as opposed to playing on Facebook or playing on Instagram or whatever TikTok video they're watching at the time while the trauma is rolling in. So at least now they're looking at the stuff I want them to look at and learning along the way. Yeah, absolutely. So if you look on this one, we actually have a pediatric surgery trauma at the bottom, which is a completely separate department. They have their own guidelines, their own things that they want the residents to know, because they do things a little bit different as kids are not quite the same in terms of their physiology and stuff. So a lot of times the resuscitation is a little bit different. So we haven't linked it for our purposes to anything that is person specific, other than we put, my phone number's in there for the nurses to call and stuff like that. If you click on nurses, you can see all of our pictures, my partners and mine. All you have to do is click the number or click the picture and they'll call me. But we haven't otherwise tied it to anything person specific. And we've tried to limit it that way simply because there's so many people coming and going, and we didn't want that information out there. Everybody may not want people to know that kind of information about themselves. We've tried to make it as pick it up and user-friendly as possible, and there's not going to be anything on there that you're upset that's on there.
Andrew's use case is probably the classic use case. I've got all this stuff, and I don't need to recreate my payroll system or my timekeeping, or I've got those systems. I might put links and buttons that take me there, and through single sign-on, I now don't have to go log in. That's super handy.
Resources, there's the ability to push out. So when you do push out notifications, you can do all sorts of things. So for instance, quizzes, you can push out quizzes for the residents. So after our Friday morning education session that we do, we'll push out an educational quiz for them. And then all those results get collated back and given to me. No, the quizzes are in the system, if I'm not mistaken.
They're in the system.
Yeah.
Or they could be a link to your LMS. Either way.
All the maintenance that's done on a regular monthly basis is performed by my administrative assistant, and she does that. It probably takes her, she changes out the schedules. She does it, she has to do it for the hospital system too, so she does them all at the same time. And it probably takes her 10, 15 minutes a month. And then the stuff that I don't want to change, I do all that myself. Because I don't want anybody else to have access to what the residents actually have other than what I put on there.
But it's pretty easy to do that then?
Yes, it's very easy.